Okay, thank you very much, and hello everyone. I should say good morning, good afternoon, or good evening, based on where you are. So my name is Hawazen Albalawi, and I'm the head nurse at King Faisal Specialist Hospital and Research Center in Saudi Arabia. I would like to start today by expressing my gratitude for the scientific committee and the organizing team for giving me the opportunity to share my work with all of you today. So I can't see anyone actually on the screen. So if you have any question or you would like to stop me, you can just unmute yourself or raise your hand. You use the reaction button. So I'm here today to share the findings of a narrative literature review about cultivating resilience in time of crisis. And mainly in my presentation, I'll be focusing on the role of the nurse leaders. So this is just only a little bit an outlines of the presentation. In my presentation, I will talk a little bit about an introduction and a background of the topic. I'll talk about the aim of the review and the method that's been adopted to conduct the review. In the results section, I will address the most important findings of the review and some of the strategies for nurse leaders to cultivate the resilience among their staff. Finally, I will conclude and I will share some of the implication of these findings. So I suppose if we reflected over the past year, we can all see the undeniable impact of the coronavirus pandemic on the global healthcare systems and the rapid growth of the reported cases and challenges that nursing workforce who are on the front line actually to safeguard the lives of the affected patient is really devastating. So in the early stages of the pandemic, many nurses who had no infectious diseases expertise were relocated from their original work units to provide care for patients with COVID-19. The shortages also of the personal protective equipments and the rising numbers of or infection of nurses among nurses themselves poses another threat to the staff psychological health and physiological health as well. So the studies showed that nurses encounter a considerable level of stress and anxiety, depression, fatigue and burnout. And this is one of the studies that included in the review. And as you can see, it was a descriptive study conducted to assess the level of anxiety and depression of nurses. And they compared the findings between the nurses worked in confirmed COVID-19 cases or nurses worked with suspected COVID-19 cases and nurses worked with or in non-COVID-19 units. So the study showed that about 35% and 56% of nurses worked with confirmed COVID-19 cases and suspected COVID-19 cases, respectively showed an anxiety level, as you can see in this figure in here. And the level of the reported anxiety ranged from mild to severe. Depression was also observed among 56% of the nurses in the COVID-19, confirmed COVID-19 units. And the percentage was really much higher with nurses who's working with suspected COVID-19 units. So nurses would work in non-COVID-19 units exhibited particularly less anxiety and depression. So these findings really immediately show the immediate impact of the COVID-19 or the pandemic that has on the nursing workforce. However, the long-lasting consequences on the nursing workforce could be more devastating. So this is the reason why that during the pandemic or during the crisis, it is critical to execute strategies to cultivate resilience as a mean to facilitate the crisis response, coping mechanism, and recovery. So what's resilience? Resilience is a personal resource that's been described in the literature as the skill of survival that nurses really need in today's challenging work environment. Resilience has been conceptualized as the process of adapting well in the face of diversity, trauma, tragedy, threats, or significant source of stress, and bouncing back from the difficult experiences. So the level of nurses' resilience is being judged by different characteristics that include coping, self-efficacy, optimism, control, hope, and spirituality. So these characteristics enable nurses to effectively utilize problem-solving skills and deal with depressive factor in their daily work, which means that resilient nurses are more capable to stay focused under stress and find meaning in the challenging experience. So although the development of nurses' resilience depends on their self-capacity and capabilities, nurse leaders play a vital role in supporting them and shaping their work environment, especially during such time or a time of crisis. So this is the reason why resilience enhancement intervention require continuous support and commitment from the nurse leaders. So in the current review, or the current narrative review was conducted to review the literature that examined the nurses' resilience during the COVID-19 pandemic and intends to identify strategies for nurse leaders to boost nurses' resilience through the pandemic. For this review, for the narrative review, an electronic search was conducted using the Saudi Digital Library that facilitate the access to different databases such as Sinal, Scopus, Embase, or Ovid Midline. The search was conducted using structured key terms and using the pollen operator appropriately. The study selection was limited to full text articles published in an academic peer-reviewed journals in an English language. So the electronic search result, the literature search yielded to 118 records. And after removing duplicates, the title and abstract of 35 publications were screened for eligibility. 15 articles were rejected for including nurses, faculty members, or student. Mainly the narrative review intended to examine the resilience for the frontliners, so excluded these populations, or also articles that's been published in a language other than English. So consequently, a total of 20 articles were retained for inclusion in this review. This review has three main findings, and the review provided evidence that nurses worked with COVID-19 patients exhibited moderate to low level of resilience, which sometimes is questionable in terms of their ability to manage the stress they are facing in such environment. So the studies that measure the level of nurses' resilience in different settings reported that nurses work in COVID-19 units and critical care areas such as ICU have less resilience in compared to nurses worked in medical, surgical, or OPD units, which put them in a more vulnerable position to develop stress and anxiety or depression. The finding also showed that nurses' resilience could be influenced by many external factors, such as the years of experience, perceived social support, organizational support, and the perception of hospital preparedness in managing COVID-19 patients. So, in the included studies, nurses with longer experience demonstrated more resilience characteristics. This was attributed to the clinical confidence that comes with knowledge and experience. The review also suggested that nurses who have good social support provided from family, friends, significant others demonstrated higher level of resilience. Similarly, nurses' perception of organizational support and hospital preparedness to compete the pandemic is evidence to positively influence the nurses' resilience. The last and the most important finding of this review is the significant effects of nurses' resilience on the level of anxiety, depression, and stress. So the reduced COVID-19 anxiety level in nurses who had higher resilience demonstrate the protective role of resilience, of the personal resilience, which would enable them to positively adapt in stressful and anxiety provoking situation and bounce back successfully despite the adverse circumstances. So this result highlights the importance of identifying interventions to promote or optimize personal resilience in frontline nurses in order to reduce their anxiety level that's generated due to the pandemic or COVID-19. So in the following section, I will address the four most cited strategies for nurse leaders to cultivate nurses' resilience during the COVID-19 pandemic. The first strategy that we found during this review is reducing cognitive burden and enhancing self-care. And I think it's reflected back on the previous presentation in this conference as well. Cognitive burden is one of the major concerns in the nursing profession. The cognitive overload could be higher in time of crisis due to the amount of information and processes within daily work that the nurses has rarely control over it. So nurses may be or may get so immersed in responding to the rising work demand and forget about taking care of themselves. So the studies also showed that many nurses view themselves as a healing profession and tend to avoid verbalizing their stressor loudly. They may feel that pointing out their stress does not really fit their role as helpers. So thus nurse leaders should work with their staff to reduce their cognitive burden through establishing a supportive work environment, which is an important factor to improve nurses' resilience. It is really important to build a potentially stress-free work environment. They could also enhance implementing realistic self-care protocols such as moment of mindfulness, exercise, or peer support. One of the identified strategies in this review is embracing self-compassion. So, self-compassion is an adaptive way for nurses to respond to the stress they encounter constantly at work and to enhance their resilience. Normally, human brains are created to have a negative bias, focusing on what is faulty and what's dangerous. In the depth of the pandemic, the deficiencies that we are encounter could potentially foster the nurse's feeling of inadequacy, leading to self-criticism. So, as such, having self-compassion or having the compassion for oneself is a powerful agent to refrain from a self-criticism and judgment into becoming more aware and acceptance of one's own emotion. So, with this to say that practicing self compassion enables the staff to embrace their vulnerability and activate self awareness and self regulation system. This in turn enhance resilience and shift the mindset from feeling threatened into a more pleasant emotion such as contentment. So, the role of the frontline leaders is to facilitate staff access to self compassion training and resource. One of the literature also included in this review was a quasi-experimental study that intends to evaluate a one-day workshop for self-compassion for healthcare communities program. The program was evaluated in terms of improving pediatric nurses' resilience, well-being, and professional quality of life as well. So the study employed a pre and post intervention survey and recruited an intervention group of nurses who attended the self-compassion training and a comparison group of nurses who did not attend the training. And also, the researchers concluded a 3 months follow-up after the original data collection point. So their finding revealed a significant change in the outcome across time for the group, but no significant changes for the comparison group. The nurses who participated in the self-compassion training reported significant gain in terms of self-compassion, mindfulness, and compassion satisfaction from pre to post intervention compared to the group who did not attend the training. The increase in these outcomes were also retained at the 3 months follow-up survey. The study also showed a significant decrease across time point in nurses' burnout and anxiety and stress from pre to post survey in the intervention group. So these findings really support the need to similar training for nurses to build their resilience through the self-compassion. The included literature has also identified the important role of coaching and mentoring in developing nurses' resilience. In fact, the evidence revealed that coaching in time of crisis is more critical than ever. While the coaching is an effective strategy to improve the professional performance by setting achievable goal, its benefit through the crisis or during the time of crisis goes really beyond that. Coaching program might contribute to resilience by improving positivity and support professional relationship by supporting the optimism, emotional insight, life balance, and spirituality. And also, the strength of coaching is its tailor-made approach to the need of individual and context. So, in time of crisis, when the brain is flooded with stress chemicals, coaching helps nurses to find their inner resilience, capacity, and the ability to make the right decision. This could be facilitated by adapting different mindset, and broaden the perspective. Coaching also gives nurses the ability to proceed the great amount of information and the traumatic events around them and reflected on what they can learn from each experience. This is really important because if these tough situation or tough events are not being processed positively as they are happening, they are more likely to be turned or converted into a trauma or a negative consequences. The last identified strategy in this review is to cultivate nurses' resilience is maintaining effective, clear, and timely communication. the evidence showed that communication is fundamental requirement to crisis management in general. In the case of the COVID-19, with so much uncertainty surrounding the pandemic, nurse leaders deal with a large volume of information from various sources. This information requires rapid interpretation and integration into the workplace or the work environment to enhance the crisis response and management. This information also leads to constant change in plans and priorities. So therefore, the effective, clear, and timely communication is essential to enhance situation awareness and boost nurses' resilience. The evidence also emphasized that effective communication should be maintained between the frontline nurses and the leaders at all the organizational level, which includes the executive, the CEOs, and so on and so forth. The evidence suggested different communication channels such as email account, hotlines, and social media platform that could be used to share general knowledge and updates. It also suggested more reliable communication methods to disseminate more complex information directly from the command center to the staff, such as the daily team huddle and frequent virtual update or meetings. So the findings of this review has important implication. The important takeaway for the review finding is for nurse leader to direct their effort to cultivate resilience among their staff, not only to withstand the current challenges, but also to develop a competent workforce that survive while facing such challenging frequently. Taking this into perspective, the resilience enhancement intervention should be integrated into the overall workforce development programs to facilitate achieving sustainable outcomes. The nurse leaders and healthcare organizations in general should provide various psychological support strategies for those nurses who needed to work well during the pandemic. The COVID-19 pandemic is unprecedented time that nurse leaders have little to compare it with. So, and the current review highlighted further research potential. Although there is a wealth of research on resilience in the context of stress, such as staff shortages, there is a need for more research to increase our understanding of resilience in crisis situations, such as what we're living now, as well as how to better prepare nurses' workforce for the future. Phenomenological or qualitative studies that draw on the lived experience of the healthcare staff involved in the care of patients with COVID-19 would also be vital to inform the development of a pandemic preparedness policies and provide the frontline workers and their leaders with a first-hand knowledge of stress point and coping strategies. So to conclude, through the pandemic, nurses experienced tremendous level of stress and anxiety and depression. And for reducing these negative effects on nurses, it is really necessary to develop strategies to enhance nurses' resilience as a mean to improve a crisis response. The literature has revealed that resilience is a complex subject that required collective enhancement approach and a continuous support from nurse leaders. The resilience enhancement approaches should focus on reducing cognitive burden, enhancing self-compassion, providing coaching, and maintaining effective communication. So thank you very much. That's the end of my presentation. Thank you for your time and attention. Again, it's my pleasure being here with all of you, and I'm happy to receive your questions.